So welcome back. We're talking about that important jab that is supposed to happen today. All eyes at Kenyatta National Hospital, where the first jab of the vaccine is supposed to be done today. Mixed reactions from the health workers, doctors, nurses. We're not sure whether they want to be the first people to get this vaccine. We've not also seen from the government probably giving us a name of someone from this government position to take the jab. But then with me in studio this morning, we shall also be joined later on by the KMPDU Central Branch Secretary General, Dr. Gorgudi. But with me in studio this morning is the President of the National Nurses Association of Kenya, Alfred Obengo, about this whole jab. You know, the nurses are a bit hesitant, saying they're not involved. And there is a question about the whole excitement, you know, from the political sector about this jab. Yet that excitement is not being witnessed. It's not being seen at the end of the day within the health sector fraternity.
You know, naturally, it's the healthcare professionals who are supposed to get first jab, who should have been excited about this whole vaccine initiative. But you're seeing a scenario whereby the politicians are more excited than us. And from their speeches and their body language, you can also see that they are not really eager to be the first ones to get the jab. Mm-hmm. So that's why I was talking about engagement and engaging the right people. Yesterday, I heard Professor Magoha, the Minister of the CS of Education, talking about teachers taking control of exams, that you cannot bring non-teachers to supervise and manage the exam process. These things, that one should also be applied to health. Let the relevant health professionals, the specific cadres, take charge of this process.
But yes, we are saying let the health professionals take charge, because at the same time, we've had the likes of the KMA, you know, the Kenya Medical Association. We're also having, you know, the Nurses Association. You're here as the president and the doctors saying that they were not involved in decision-making about the vaccine. Why do you think the government left out the health sector representatives?
I wouldn't know for the reason why they left the main players within the health sector, because also when you look at the task force, the list of the task force members insofar as the vaccine initiative is concerned, okay, it's loaded with professionals. But there's one thing that sometimes we also forget, that within our professional bracket, within the bigger spectrum of the healthcare industry, we also have leaders within that industry that the health workers have confidence, have trust in more than other, because these are the leaders that they identify with. They're the leaders that they voted for so far as representing their interests. So that's something that really the mainstream authorities need to understand, so that they bring us on board. Because when people see one of their own sitting somewhere, they'll have some confidence. And for me, I'm able, and I have a network that I'm able to get the views of almost all nurses from all the corners of this nation. And they are free to tell me some things that they may not even be free to tell the CS. Right. So these are the things that we can address as leaders when you sit on a round table to demystify these misconceptions.
But then, you know, it's a bit interesting, because Kenyans are looking towards the health sector, the health professionals, to give them assurance that this vaccine is okay, you know, come and get the jab. So if Kenyans are looking at you people and at the same time the health workers are afraid, don't you think this will make Kenyans to be more hesitant in terms of taking the jab?
It is natural, and it's also not too late. It's natural that probably the way the health workers are going to respond to this vaccine will influence also the way the larger populace will respond to this vaccine.
All right.
So it is not too late to engage the health workers in a manner in which the response may be more positive.
All right.
I was wishing for a situation whereby if with the engagement, we can have more like 80% consensus, more than 80% consensus within the health sector workers, so that they can give confidence to the larger populace.
So what is the main fear? What is the main fear that nurses have?
You know, any new phenomenon, but you know, vaccination is not. This is not the first time that we are having vaccination within our the populace. I mean, just that this is a disease that is new, and the vaccine is also new. But and then we also know that scientifically, and even from the WHO statements, some of this the initiative is more or less on a trial basis. And so those are some of the fears that you can see you can feel from our nurses. And then there are also issue of the side effects. Though the side effects are not that pronounced, but there's also this issue that we're also happy, which have not also been addressed by the Kenya government, that the WHO has said that any side effect that you can get from after being given the jab, you must be compensated.
All right.
So those are the fears that we have, because also you find that during our the fight against COVID, some of our colleagues, healthcare, frontline healthcare workers who contracted the disease were not receiving free treatment from the disease.
All right. So now the government is talking about training the health workers, the nurses, the doctors. So what is this training? Because when I look at taking a vaccine, you know, I've taken a vaccine before. It's just getting the needle being injected, and there you have it. You're good to go. So what is so special about this COVID-19 vaccine, and what sort of training? When you talk about training, what kind of training will the nurses get?
Actually, the training on so far as vaccination is concerned generally is a continuous process. There's the issue of the cold chain management from where the president flagged off the vaccine yesterday at Kitengela up to where it will reach the recipient. It must reach the recipient when it's still potent. So that means that cold chain process must be maintained in such a way that the drug doesn't lose its potency. And then from when it's removed from the fridge and it's the handling by the person who is going to vaccinate and so on and so forth, it needs a little bit of training. But these are things that have been going on because this is not the first vaccine that we're having. But most important, and what I want to emphasize, is actually the issue of sensitization.
All right.
Because this is a new phenomenon. So people must be sensitized on the same to allay those fears that are there.
All right. So let me just quote because you're on record on the Standard newspaper for Wednesday. This is what you said. You said that healthcare workers have not been engaged. Reason, there seems to be some hesitance. The public are also asking about the efficiency of the vaccine, but we do not have answers. So hence my question. Probably today at Kenyatta National Hospital, should nurses see one of their own being the first person to take the jab, will you change your minds? Will you actually change your mind, sorry?
I've said that the vaccine jab is voluntary, and we are not really pronouncing that or discouraging anyone from taking it. What we are saying is that we want to create a scenario whereby we can think and approach the vaccine with the same information, with the same strategy, so that we have maximum receptance of the vaccination. Otherwise, I know there are nurses who are very excited insofar as receiving the vaccine is concerned. There are also others who have misgivings. So for me, as their leader, I would have wished a situation whereby, as I said before, we have at least an 80% consensus with positive reception to the vaccine. But what I'm seeing as of now is there is that reluctance. And you also are aware that we've just come from a situation whereby we had an industrial unrest within the health sector, where some wounds have also not healed. So these are things that we should have come and together as a community, as a country, to manage with a little bit of more wisdom, so that we address some of the little concerned, and also we bring everyone on board.
All right. But then let me just try and be the advocate, the devil's advocate over here. So I'm assuming, for example, I'm a Kenyan, I've gone to the hospital, I've taken the COVID-19 jab, and a nurse who's attending to me or a doctor has not taken the jab. Clearly, there is a risk of both parties, you know, contracting the disease, because as much as you have the jab, the government, you know, WHO has been saying you still need to adhere to the protocols that have been put in place by the government. Don't you think this nurse or a doctor is still at risk? more at risk, actually, than the Kenyan who's taken the jab?
Scientifically, we know that once you've taken the jab, it's not more or less like 100% shield insofar as contracting the disease is concerned. The jab is just helping you not develop severe symptoms. So actually, it's just mitigating the adverse symptomatic ailments that you may have. Mm-hmm. So what is important is that, and that's why I said from the outset, that we as the health workers, we also mingle with the community. And the community also wants to hear from us. Is this vaccine safe? Because you are the professionals. It's just like when a road is being constructed within your area. Mm-hmm. The first person to ask about the quality of the road construction is the road engineer.
All right.
So it still applies to us here. The first people that the public runs to is the health professionals. Mm-hmm. That is why it's very, very important to have the health professionals right from the village to be actually acquainted with the relevant information so that they can help the government to pass that information to the populace. So that the populace can have more confidence in terms of receiving this vaccine.
And as we bring this conversation to an end, what sort of assurance do you want from the government concerning this vaccine?
I want to be very positive from where I sit, that at least after making the noise here and there, we've been engaged. We started our first virtual meeting, I think, on Tuesday, and we've started engaging and sharing information, of which I actually said in that meeting that that forum could have actually started much more earlier. Mm-hmm. It was belated. So when we will continuously engage each other, I think, and we share information, some of these fears will be allayed.
All right.
And lastly, even within that task force, let it be a mixed skills.
All right.
I mean, let's have all cadres represented in that task force. That builds more confidence within the entire healthcare workforce.
All right. Asante sana, National Nurses Association of Kenya President Alfred Obengo, for talking to us about the Covid-19 vaccines, the sort of fears that the nurses in the country have. We wait and see what will be done and who will get the jab today. But then, to developing